Come in.
Hey, how are you doing today?
Good.
I'm Kaya and I'll be your nurse. I'm going to be performing a head-to-toe assessment on you today. Is that okay?
Yes.
All right. Can you give me your name and date of birth?
Gabriella Jones.
Okay.
12/12/87.
All right. I'm just going to check your armband. You don't have any allergies, do you?
No.
Are you having any pain today?
No.
On a scale of 0 to 10, what would you rate your pain?
0.
Okay. Can you tell me what time it is? Around what time it is?
Maybe about 1.
Around 1? Do you know the date?
Yes, it's April 3rd, 2019.
Okay. Do you know what we're going to be doing today?
A head-to-toe assessment.
Okay. And then your location. Do you know where you are?
Yes, Central Georgia Tech Hospital.
Okay. All right, I'm going to start off by taking your vital signs, if that's okay.
Yes.
Do you have any pain, any fever, nausea, vomiting, discomfort, anything like that? All right, I'm going to start by taking your blood pressure. Have you had any surgeries on this arm?
No.
All right. Any lymph node removal, breast removal?
No.
Okay. I'm going to start off by doing that. Let me also get your temperature. Okay, if you can just hold this under your tongue.
Okay.
No talking. All right, 99.1. All right, can I feel a tight squeeze on your arm for a moment? Right, 119.78. That's perfect. You don't take any high blood pressure pills or anything, do you?
I do.
You do? You took some before you came in this morning?
Yes, early this morning.
Yeah, right. I'm just going to put this on your finger to get your oxygen status. All right, we're at 99%, which is good. All right, I'm going to take my gloves off and wash my hands again. And I'm going to check your pulses.
Okay.
All right. I'll just check your radial pulse. All right, do you mind if I look at the other side so I can compare? All right, they're 2+, which is in the normal range. I'm going to take your pulse for a full minute. So if you can just lay relaxed. All right, your pulse is around 70, which is within normal range, and your respirations are 16. So that's pretty good. All right, so the next thing I'm going to come in and do is start your head-to-toe assessment. I'm going to start with your head and neck. Then I'm going to move down to your abdomen, and then I'm going to check your extremities and your lower extremities for pulses as well. Are you having any discomfort? Are you still okay? I'm going to check your eyes for symmetry. I'm going to make sure they're not sunken in, no eye bulging or anything like that. I'm going to have you follow my pen light to make sure there's accommodation and reaction to the light. I'm also going to make sure you don't have any ticking or your eyes aren't crossing, and if you don't have any anoscorgia, which is one pupil smaller than the other. Okay? Right, so just looking at you, your face looks symmetrical. Your nose is symmetrical, your lips. I don't see any drooping. Your eyes are symmetrical as well. All right, so for your pupils, they normally range from 3 to 5 in millimeters. So I'm going to just take a look at them. Normally, they look about a 4. All right, so I'm just going to shine the light into your eyes. Okay. All right, normally we would do this with the lights dimmed, but all right, so I saw your pupils constrict and then dilate. So they're normal reacting, and they reacted to about a size 3, so which is good. So right now I'm gonna put some gloves on so I can check your conjunctiva. I'm just gonna pull your eyelids down and make sure there's not any erythema, which is redness. There's no drainage. You don't have any eye infections or anything. You don't take any eye drops or anything. Okay. You wear glasses or need any assistance with your vision?
No.
Okay. All right, so I just washed my hands. I'm going to put my gloves on. All right, and I'm just going to pull your eyelids down. All right, I don't see any redness or drainage. The sclera of your eyes are white. There's no irritation. I don't see any redness, any yellowness, which is indication of jaundice. I'm going to use my pen light to check in your nose really quick. You can just look up. All right, they're pink and moist. Now, have you open your mouth. I'm just going to be checking your gums for any lesions or any broken teeth, missing teeth, any infection or anything like that. All right. All right, so pink and moist. They're good. I'm going to use my tongue depressor to check the inner lining of your mouth. I'm going to also check your gums. All right. You don't have any pain? I can see that you have good oral hygiene. I see that your braces are intact. You don't have any broken brackets or anything like that. Still no pain? All right, can you stick your tongue out for me? All right, I don't see any discoloration. Your tongue isn't swollen. I don't see it's smooth or like a beefy red color, which would indicate that you have some form of anemia. Can you stick your tongue out and move it to the left and right? All right, there's nothing there. Can you lift up your tongue for me? All right, everything's intact. I don't see any lesions. You don't smoke or anything, do you?
No.
All right, you take really good care of your mouth. All right, so now I'm gonna just take a look at your neck. Make sure that there's no distension of any veins or anything. All right, can you turn your neck to the right for me? All right, so I'd be looking right here. If there was any distension of your jugular vein, there would be like a bulging on this side, which seems to be good. Can you turn to the other side? All right, I don't see any indication of that. I'm just gonna check to see if you have any swelling. Any of that hurt when I touch you? All right, can you look straight forward and hold your neck? All right, we don't have any distensions or any masses or lesions or anything on your neck, which would indicate that you have any thyroid problems or anything like that. So everything looks good on that part. So after I test your pupils one more time to see if you have any strabismus or anything, which is like ticking or moving of your eyes, I'm going to go ahead and move down to your abdomen, and then I'm going to check your extremities and your pulses, range of motion, and things of that nature. Is that okay? Mm-hmm. All right. So when I check your eyes for the last time, I want you to look directly at the pen light. I'm going to check your eyes for accommodation. I don't want you to turn your eyes to the side or anything. I mean, your head to the side or anything. I want you to follow with your eyes, but not turn your head. All right, so I'm going to bring my pen light directly to your nose and just follow it all the way out and follow it back in. All right, I'm going to do some more testing. Okay, so I didn't see any twitching of your eyes. Your eyes reacted just fine, and you have good motor function and all of those things. So I'm just going to take a step out, wash my hands, and I'm going to go ahead and proceed with the rest of your assessment. You still doing okay? Mm-hmm. All right, and I'll be right back with you. All right, so right now, Miss Gabby, I'm just going to go ahead and listen to your heart, and then I'm going to listen to your lung sounds.
Okay.
All right, right, so we're going to take the diaphragm and we're going to listen to, we're going to start out with the aortic, and then we're going to move over the sternum to the pulmonic, and then we're going to move down to the tricuspid, and then under her breast, we're going to listen to the apical for a full minute. So in order to find the landmarks, you want to start up at the top where the clavicle is. We're going to go down two costal spaces and get to the first landmark. All right, so we're going to listen to the S1 and S2, which is the lub-dub. We're going to start with the aortic. All right, we're going to move over the sternum until the pulmonic. All right, we're going to move down to the tricuspid. All right, and then do you want to lift up your breast, or do you?
Oh, you can.
Okay. I'm going to listen to this for a full minute. Let me see.
Let's go.
Sorry if my stethoscope is cold. All right. All right, so your apical pulse is at 84, which is within normal range. I heard the S1 and S2 and every landmark on your chest for your heart sounds. I'm going to go ahead and check your skin turgor. I'm just going to see if there's any tenting on your chest. That just indicates if you are dehydrated or anything like that. So I'm going to go ahead and listen to your breath sounds on anteriorly, which is on the front side, and then I'm going to turn you around, and then I'm going to do on posteriorly. All right, so every time I touch you with the stethoscope, just take a deep breath in your nose and let it out of your mouth. All right, so you're going to start high within the neck. Deep breath. Okay. All right. All right. Again. All right, all your breath sounds sound clear. They're not labored. And then I'm going to check up under your arms to see if I can hear them as well. So I'll just check where your rib cage is. Just deep breath and inhale, exhale slowly. All right, deep breath. Okay. All right. All right, those sound clear as well. I'm going to go ahead and lift you up and have you turn to the side and dangle your feet. And when you do breath sounds, you want to listen to the sounds in a zigzag pattern so that we're checking to see if they're equal on both sides. All right, I'm just going to lift your shirt. All right, deep breath. Deep breath. Again. Again. can take a look at her posture, and I can see that there is no curvatures or anything. She didn't have kyphosis or any scoliosis or anything. Now I'm just gonna check for any kidney pain by percussing her flanks. I'm just gonna put my palm open on the bottom of her back, and then I'm just gonna tap it with my fist. So let me know if you feel any pain, Miss Gabby. All right? All right. So if she had any tenderness or anything of her kidneys, I would notice that with any flank pain.
I'm gonna lay down.
You can lay down. So I'm gonna go ahead and move to her abdomen. All right, I'm gonna lay you flat. Now, right now I'm gonna notice for any lesions, any scars, any masses, any distension or anything like that. So I'm gonna go ahead and lay you flat. And I'm just gonna raise you up just a little more. Okay. Just so we can get a good look at your abdomen. All right, first we're going to inspect it, then I'm going to listen. If you could just raise your shirt. Right now, just visually, I don't see any masses, I don't see any discoloration, any scars or anything like that. So I'm going to next listen to it. I'm going to do the right lower quadrant first, and then I'm going to go to the right upper, the left upper, and the left lower. I don't want to palpate it because I don't want to wake up anything and her bowel sounds become hyperactive. All right, I'm going to take a listen. Okay. 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 All right, and I hear bowel sound in all quadrants. If there was absent bowel sounds, I would have to listen for 5 full minutes to document that there was absence of bowel sounds. There's no chance you could be pregnant or anything? Mm-hmm. Okay. When was your last bowel movement?
This morning.
Okay. Did you, when did you last urinate?
Probably like 30 minutes before you came in.
Okay. So I'm gonna check and see if there's any bladder distension and make sure that there's nothing going on there. So I'm just gonna palpate it. You don't have any pain? Mm-mm. Okay, I don't see anything there. And now I'm just gonna slightly press on your stomach to make sure there's no masses or anything. Just tell me if it's too much. Any pain?
No, just ticklish.
Just a little tickle? Okay, so I'm gonna continue to do that. Okay, so you do light, and then I'm gonna go a little deeper. Let me know if you're feeling any pain. I don't feel any masses or anything. No drainage, anything like that. So your abdomen sounds good, everything sounds clear. So I'm going to sit you back up and reassess any other assessments that I need to. You're still having no pain, no discomfort?
Yeah.
I didn't see any face grimacing, so I know that everything was fine. Or she didn't indicate that she had any pain. All right, so we're gonna move down to the lower extremities. I'm just gonna take a second and wash my hands, and I'll be right back. All right, so now we're gonna move on to the upper and lower extremities. We've already palpated the radial pulses. They were 2+ and equal. So now we're gonna move on to the lower extremities. I'm gonna have Miss Gabby perform some range of motion exercises. She's already moved to a sitting position, so I won't make her get back in bed. If your client was had difficulty ambulating or range of motion limitations, you wouldn't want to have them placed back in bed to perform this assessment. So I'm going to go ahead and start off. I'm going to feel the warmth of her skin, and then we're going to do the upper and lower extremities. All right, so I'll have her hold her arms out. Okay, so now we're just going to feel for any swelling. I'm going to notate any edema, any lesions, any scars or anything. You don't have any pain when I palpate, you do?
No, ma'am.
Okay. We're going to move on to her arms. None of this hurts.
No, ma'am.
Okay. And then, so she does have nail polish on, but you can look at the pads of her fingers. And I'm going to hold them. And we saw the blood return in less than 2 seconds. All right, so I'm going to have her squeeze as hard as she can. All right, so she has number 5 in strength. I'm going to have her move her arms inward and outward. You can also hold your client's elbow to make sure there's no grazing when they move in and outward. No clicking or anything like that. You don't have any pain, do you?
No.
All right, and I'm going to have her hold her other one out. I'm going to check this one for any swelling. It's warm. It's appropriate for her ethnicity. I'm going to perform a few exercises. No pain?
Mm-mm.
All right, and we're going to check the capillary refill as well. All right, blood return in less than 2 seconds. I'm going to also feel this elbow. If you can just pull your arm inward and let it back out. All right, I don't feel any grazing or clicking. And then I'm going to have her pull her arms across, up and down, and away from her. So full range of motion. And I also observed her range of motion when she was able to come from a lying to a sitting position. So she didn't have any limited range of motion there. So we're going to move on to her lower extremities. The client would normally have a gown on, so you could just raise their gown and then you can just palpate their legs. It's warm. I don't feel any lesions, any nodules, or any notable scars, because I could see her legs from here. And then I'm going to go ahead and palpate her pedal pulses. And we're going to compare them both. Right, they're normal, which is 2+, and they're both equal. All right, and the same thing, she does have polish on her toes, so I could, any of the lightest, where you can see the blood, you see it disappear, and then you see it return in less than 2 seconds. So those are good. Can you lift your foot and do some ankle twirls for me? All right. No pain?
Mm-mm.
Okay, and your other one? All right, that's fine. Can you march in place for me? Okay, can you extend your leg all the way out? All right, and then the other one? Okay, no pain in there?
Mm-mm.
All right, time you can also have your client, if she had to go to the restroom and she had to walk across the room, I could notice her gait and see that there are no visible limitations in her range of motion as well. After we've done all her pulses, you can do the popliteal and the femoral, all the pulses, and go ahead and turn the assessment over to the doctor, and we can document it in our SIM chart, and that will complete our assessment.